So it looks like Dr. Avery has created new orders for Betty Jones, my patient. Lamar here. He would like Betty to have 1 unit of packed red blood cells. So I'm going to go ahead and grab my supplies so they're outside the room and go talk to Betty. All right. Bringing in the room with me, I have a consent form for Betty. And we're just going to go talk to her. So to put outside the room so I'm all ready, I have my blood infusion set. I have a 500 ml bag of normal saline, some tape, and a pen to mark my tubing when it's all done. And then I have gloves here in the room. Okay. Hi, Betty. I'm Hannah. I'm going to be your nurse today. So Dr. Avery says that your lab values are looking a little low. You're a little anemic. So he'd like to give you 1 unit of packed red blood cells. She says, okay. So Betty, I'm going to talk to you a little bit about what that means and some possible side effects, because everything has potential for risk. She says, okay. So before we get move any further, I just want to verify that I do have the correct patient. I've been with Betty all day, but gotta verify. So I'm going to look at her armband. Her armband does say Betty Jones, 5/21/1952, which matches what I have here on my MAR. Betty is alert and oriented ×4, so I can trust that she knows what she's consenting to when we get to that. Okay, so, and as well as Betty also has a red blood band, which means that the lab has come up, they have done typing and compatibility, which I will have to verify later. So Betty, with these packed red blood cells, the risks include there could be an allergic reaction, which could be hives, a backache, fever, chills. You might get a headache. You might have trouble breathing if it was really a bad reaction. But those are all things that we are going to watch you for. And after I start this blood infusion, I'm going to be staying with you for 15 minutes just to make sure that there's no immediate reactions, and then I'll be checking on you every 15 to 30 minutes as well, okay? She says okay. She understands the risks, and I did tell her that why she's getting this, so she's going to go ahead and sign her consent form. So I have that. It's also signed by her physician, Dr. Avery, and the date today, which is the 18th of January, 2020. So I have that. That's going to be on file. All right, Betty, I'm going to go ahead and do some assessments on you. I need to make sure that everything matches before I go get that blood, because it can't be up here for more than 30 minutes before we start. So I need to take a look and see what kind of IV she's got, because that's first and foremost. I want to make sure that this IV is patent before we go get that blood. So looking at her IV, remove that. I look at the dressing, it's clean, there's no signs of discharge, it's not red. When I press on it and I ask Betty if it's tender, she denies any tenderness or pain. It looks okay. This is a pink gauge that tells me it's a 20 gauge cannula. Looks okay. I could use a 10 mil normal saline syringe to flush it and make sure that it's patent as well. So that's all good. Okay. Now, I want to go ahead and take some vitals on Betty and just see where her baseline is. So, I'm going to go ahead and wash my hands. Okay. Betty, I'm just going to listen to your heart, and then I'm going to take a listen to your lungs as well, okay? All right, nice deep breaths for me now, Betty. And then there's also 10 sites that I've listened to on her back as well. I'm going to check her radial pulse on both sides, just see how her peripheral pulse are doing. A little thready, but regular. which is what I would anticipate with her needing some packed red blood cells. I've also taken her blood pressure. Her blood pressure is a little low as well. We'll say it's 90/58. And we'd like her to be a little higher than that. So now I'm gonna document that in the room here. So I have my baseline. Okay, now that I've done that, I'm gonna go ahead and put some clean gloves on. I'm gonna go ahead and flush my tubing and make sure that's all appropriate and good before I go get my blood. Okay, or actually, you know what? I'm gonna go get my blood so that I have it here in the room. Okay, so the lab has called. They said my blood is ready. I'm gonna go ahead and take this back to the room, and we're gonna verify that we got everything we need. I'm gonna bring in my second registered nurse. For this purpose, I would be a registered nurse as well, or I would have a second. If I was a student, I'd have a second registered nurse as well, because it requires at least 2 licensed professionals. Okay, so that's my consent form. I have my blood here, so as I read off my blood, the other nurse is going to read it back to me. So I have medical record 224466.
224466.
This is from the HLRL.
HLRL.
Account number 123456.
123456.
This is for Betty Jones.
Betty Jones.
With the red armband. Looking at the armband now. Number 456654.
456654.
Okay. And on here she has her compatibility, her blood type, which is B positive.
B positive.
Okay. This bag here is 250 mils.
250 mils.
Of packed red blood cells.
Packed red blood cells.
Okay, I'm looking at the expiration date. It's 5/22/2020 at 2000.
5/22/2020 at 2000.
And the donor blood type is O positive.
O positive.
Okay. I have verified that the compatibility test has been completed based on her red band here. And it has been verified. Oh, and the date today is 1/18/2020.
1/18/2020.
Okay. So, now, I want to set that there. Okay. I'm going to put on some clean gloves. I'm going to wash my hands and put on some clean gloves. Now, while I was doing all that checking, I want to look at the blood. I want to make sure that I don't see any gas bubbles, clots, make sure it's not discolored and looks weird at all, which I was looking at while I was checking this. Okay, so. Oops, obviously I would not let that hit the ground. First thing I want to do when I take my tubing out is I want to clamp everything. Last thing we want to do is ruin this donor's blood. They worked very hard to give it to us, and we're very fortunate to have it. Okay. So. Okay. So, I'm going to hang you up here. I have my normal saline. Now both of these are sterile, so I want to make sure I maintain that sterility. Make sure I don't touch it to anything. I'm going to spike my bag. It is clamped yet. Okay, so now I need to go ahead and flush all my tubing. So I'm going to go ahead and do that now. the spike that would be for blood.
May I have your attention? The NTC campus will be closing at 2 p.m. today due to inclement weather. Thank you.
Now that I've flushed that and flushed this, I'm gonna look at my my what's it called my chamber here, and I want to make sure that I have a nice little cushion here for my blood to fall on. That's really what this is for, so that we're not destroying the blood cells as they drip. Okay, so now I want to go ahead and, before I start this, I'm gonna invert it back and forth a couple times, make sure that it's all good. I can look at it again, make sure that it still looks okay. Talking to Betty this whole time, you know, just kind of making sure she still feels okay and she's confident. Now, before I do anything else with this blood, I need to make sure that my saline is locked. Do not want this to infiltrate into my blood bag, and it is clamped. So I'm going to, oh, I took that one off. I'm going to invert this. Okay. And I'm going to unclamp, and I'm going to let my blood infuse into my chamber here. Okay. Now, with my, I'm going to hang this up here. I'm going to go ahead and clean my IV. I have my alcohol wipe. Okay, so I have my alcohol wipe. I want to go ahead and clean this port for 30 seconds. Okay. I would remove my cap here. Going to connect. Okay. All right. Remove my gloves. I'm gonna load my pump here. Sanitize my hands. Okay. I'm going to program my pump. Now, initially, I want this pump to run at 50 mils per hour. So that it goes at a more slow rate. I want to be able to monitor my patient and, you know, watch for any adverse reactions. I don't want to just go right down. Okay, so on this pump, I'm going to choose blood, red blood cells. These are packed red blood cells. So that's another check that we're doing here. Okay. Yes. Now, rate, we're going to do a 50 mils per hour. Volume to infuse, I'm just going to put 50. That way I know no matter what, it's going to beep when that 50 is up. Okay. I'm going to make sure that all my clamps are off. My blood is good. I'm going to go ahead and hit start. Now my 15 minutes that I'm spending with my patient does not start until the blood actually gets to the IV cannula here. Once that starts, I'm going to sit here with Mary for about 15 minutes, watching her, talking to her, making sure there's no change in level of consciousness, Make sure she doesn't have any problems with breathing. Oh, my pump says there's air in line, so I would want to go down. I'd want to check and make sure everything looks okay. Let me pause that for now. So, assuming that there's no adverse reactions after 15 minutes, then I could just come back every 15 to 30 and check on her. But after that initial 15 minutes, I'm going to go ahead and do some more vitals. So, all right, Mary, I'm just going to go ahead and listen to your heart again. Nice deep breaths for me. Mary's not having any trouble breathing, so she's doing okay here. And I would check to make check the 10 sites on her back, listen to her lungs. I'm gonna go ahead and check her radial pulse again. Radial pulse is feeling a little stronger. I would anticipate that, after maybe half an hour to an hour of this infusing, perhaps I would see an increase in her pulse. Maybe it would be a little stronger. Perhaps her blood pressure would rise a little, but I'm not expecting it to be a total change. So that's what I would do if there was no reaction or adverse reaction. But if there was an adverse reaction, what I would want to do is I would want to discontinue the infusion. I'd want to go and run and get a new saline bag, new tubing. I'd want to hook that up, and I would want to flush my saline. Flush it through the line to make sure that we're stopping any adverse reactions. Then I would want to call my doctor, and I'd want to see what he wants to do. He may want to restart the blood and just go at a slower rate. Maybe she was starting to have a little trouble breathing, maybe she had some hives. But he may say, nope, we're just going to discontinue that. And in that case, I'm going to go ahead and take my blood and the blood tubing, and I'm going to send it down to the lab. But I would want to follow, but immediately before I even check on my patient, after I start that normal saline, the fresh saline, I'm going to check her vitals again and just see where she's at. But before I do that, I want to start the saline to kind of just flush out and reverse some of that. I'm going to go ahead and pause this again. After 15 minutes, I want to increase my rate to 125, or whatever the prescribed rate is that the physician wants. So after the infusion is clear, or after her line is cleared, with the normal saline. So, okay, I'm getting ahead of myself here. I've talked about what I would do if there were adverse reactions. So, assuming that there are no adverse reactions, what I'm going to do is I'm going to come back and check on her every 15 to 30 minutes. Everything's good, okay. Her blood has started beeping at me. There's only a very minimal amount left in this tubing because, of course, we don't want to waste any blood. After that's done, I'm going to stop. I'm going to clamp my blood, and I'm going to open my normal saline. What I'm going to do is I'm going to let that flush all the way through the line so that there's so we can give the patient as much blood as possible, and B, so we're not wasting any blood and dripping anything, because when this is finished and it's all ran through, I have to discard my blood bag and my tubing in the biohazard waste bin. All right, so the last thing I want to do before I leave Mary's room is mark on a piece of tape when I started my infusion when the infusion, I guess you could put on there when it would need to stop, because the tubing in the blood is only good for 4 hours. So I'd want to make sure that no matter who came in here, they could see exactly what I had running, exactly when I started this. Because even if she needs another unit of blood, I have to get a new unit of blood, get new tubing, unless that 4 hours is still good. So I can go ahead and turn this off. Alright, so last thing I'm going to do is I'm going to check on Mary, make sure she's doing okay. I'm going to give her a call light, make sure her bed is in a safe position, make sure she has everything she needs. Then after that's done, I'm going to go ahead and clean up my supplies. I'm going to wash my hands, dispose of my blood and the tubing in the appropriate areas. And then I want to go and document. And I'm going to be documenting pretty much everything that's on that transfusion sheet. So that's going to be the blood type, the medical record number, the account number, where the blood came from, that particular patient, how she tolerated it, the amount that was infused, and at what rate. I'm going to document where the infusion took place, so where that IV is, and the size of the gauge. I also want to document, like I said, how she tolerated it, and the compatibility, that I verified everything. Okay, so after I've cleaned everything up and I've washed my hands and documented, then that would be the completion of the skill.